Let's compare original Medicare to Medicare Advantage. This is going to be a long form video. If you don't have time to watch it now, save it, click it over here and save it. And if you want to connect with me on this topic, click here to learn more. Let's discuss. The article behind me appears in Medicare and You 2024. I'm going to use it as a guide for this discussion. I'm actually also holding it in my hand, which is why I may be looking down a couple times. And it's a great resource, Medicare and You. So anytime you're looking up a topic on Medicare, it is a great place to start. So let's start with this. Before we get into the differences between the two systems, original Medicare and Medicare Advantage, remember that everybody signing up for Medicare is going to start with the Social Security Administration. And whether you go original Medicare or Medicare Advantage, you're going to want to sign up for Medicare Part A and Medicare Part B. Original Medicare means your care is handled by the Centers for Medicare and Medicaid Services. Medicare Advantage means that your care is handled by a managed care company. So let's start by talking about access to doctors and hospitals between the two systems. If you stick with original Medicare, you can go to any doctor or hospital in the entire United States as long as they participate in Medicare. And typically to see these doctors or go to these hospitals, you do not need referrals. When it comes to Medicare Advantage, it's different. You're going to have doctor networks, typically going to be in an HMO or a PPO. And just like pre-65 insurance. And if you're in an HMO, you're typically going to need a referral to see specialists. Next, let's discuss the costs, how the costs differ between the two systems. Now, first, as I mentioned, everybody is going to sign up for A and B. And hopefully A, whether you're in original Medicare or Medicare Advantage, doesn't cost you anything. Hopefully you have earned it premium free by paying that FICA tax. You need 40 credits or 10 years of work to have a $0 monthly premium. When it comes to Medicare Part B, there's a standard premium in 2024 of $174.70, and there's something called IRMA, which, if you have higher income, you may pay a higher monthly premium, and you are going to pay that Part B premium whether you stick with original Medicare or you go into Medicare Advantage. Now, the two systems are designed differently as far as how you cost share. When it comes to original Medicare, Medicare does not cover every dollar. So for example, Medicare would cover 80% of a Part B bill, and then there's 20% remaining. That 20% is uncapped. So if you don't have a Medicare supplement policy and you have a $100,000 bill, you're going to owe $20,000. The system in original Medicare is different than a Medicare Advantage plan in that in the Medicare Advantage plan, there is a cap. There is a max out of pocket that they set, and it is defined by the plan. And if it's a PPO, they're going to have an in-network max out of pocket combined with an out-of-network max out of pocket. So if you are in this Advantage plan and it defines it and it says the most you could spend is $4,000, not including your drug copays, and that's going to be the most that you can spend out of your pocket. With the original Medicare system, being that there is no cap in what you could spend, especially when it comes to Medicare Part B, you have the option to purchase a Medicare supplement policy. And if there are 9 or 10 different gaps in original Medicare, you can choose a plan to cover most of the gaps. One gap that you no longer can cover with the Medicare supplement policy is the Part B premium, the Part B deductible, which in 2024 is $240. So the point being is that with a Medicare supplement policy, that's how you stop your spending. And basically what you're doing with the Medicare supplement policy is you are paying up front. You're paying this monthly premium for the supplement, whether or not you step foot into a doctor's office, but you know exactly what you're spending. And the plan that covers more of the dollar gaps is going to obviously have a little bit of a higher premium. So that's something you'd go over with your agent to figure out which is going to be the best plan for you. When it comes to Medicare Advantage, as I mentioned, there is this cap, and it's called that max out of pocket. But what happens is with that max out of pocket, the plan is going to define copays and coinsurance, and you're going to pay them every time you have a service. So let's say you had a 2-night hospital stay and you had to pay $325 a night. That's going to go towards the max out of pocket that you can spend. Now let's say you have a $50,000 hospital bill, but your max out of pocket is $4,000 and you've met it, then it is the plan's job to pick up the rest of that bill. With this max out of pocket in a Medicare Advantage plan, you cannot buy a Medicare supplement to fill in those gaps. Some people do buy an indemnity plan to help them cover the hospital costs if they have an inpatient stay, or a cancer plan, because Medicare Advantage plans, you have to pay 20% of chemo or any Part B drugs. So sometimes people buy some sort of supplemental coverage, but that means there is an additional premium. And by the way, talking about premium, most Medicare Advantage plans are a $0 monthly premium. Whereas if you're in a Medicare supplement policy, that means you're taking on an additional monthly premium, but you are capping what you can spend. With Original Medicare, you have to get a separate policy if you want prescription drug coverage. Now, there are some medications that are covered under Medicare Part B that you're, with your doctors or if you go to a facility. But for the stuff you pick it up at a Walgreens or a CVS, you're gonna need a separate plan. Typically, there is some sort of a monthly premium and you're gonna have copays and coinsurance. Now, if you're in a Medicare Advantage plan, most people are gonna get a Medicare Advantage plan with drugs built in. There is no additional premium typically for that Part D coverage. And in these Advantage plans, just like in Original Medicare, you're gonna have copays and coinsurance for the drugs that you pick up at the pharmacy. And as I mentioned earlier, when we talk about that max out of pocket, it does not include the drug copays and coinsurance. Now, when it comes to coverage under Medicare Part A is your hospital coverage, Medicare Part B is your doctor's coverage. And I'm gonna read the language right up there. Original Medicare covers most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. Original Medicare doesn't cover some of the other benefits like eye exams, most dental care, and routine exams. You will possibly get that kind of coverage for dental, vision, and hearing through a Medicare Advantage plan. Now, the Medicare Advantage plan, their job is to cover the medically necessary services that are defined by Medicare Part A and B. And as I just mentioned, they may offer additional benefits like dental, vision, hearing, a gym, etc. Now, all that sounds great, but there is something you really need to understand when you look at Original Medicare versus Medicare Advantage. When you're in Original Medicare, for the most part, if your doctor determines you need this care and it's medically necessary, you go and you get that care. You typically don't need prior authorization. Sometimes you do for some durable medical equipment. But when it comes to Medicare Advantage, for a lot of the more expensive services, you are going to need prior authorization from the managed care board. So if your doctor recommends care, before you can go and get it, that's where the prior authorization comes in, and that's where there has been some controversy over Medicare Advantage. Are people getting the same coverage that would have been covered under Original Medicare? There's been a lot of spotlights on that. Hopefully that's going to keep improving with time. The last thing I want to talk about, foreign travel. So Medicare is for your care in the United States. But if you have a Medicare supplement policy, a couple of the plans do cover emergency if you're traveling for 60 days out of the country. There's like a $250 deductible, and then the plan will pay 80%. You'll have to pay 20% up to $50,000 lifetime. Not all supplements are going to cover that. When it comes to Medicare Advantage, it's also not designed to cover foreign travel, but some of the plans may have some coverage for emergency care outside of the United States, just like they would under Original Medicare. So which one is the right one for you? It's going to depend. That's what I do. I talk to my clients about both. Over here, if you want it clean, any doctor you want to see, no prior authorization, but a little more costly, that's going to be Original Medicare. If you want to keep your costs down, you make sure your doctors are on the plan and your drugs are cost effective under a plan, and you want those perks, maybe you consider Medicare Advantage.